So I'm excited to be able to share today a lot of things. And I really want to focus on the answers that you've been looking for when you're struggling with chronic health. That's what I see every single day in my practice are people who've been to multiple practitioners, multiple doctors. Often we're sixth or seventh on the list because people think, what could my tooth health, my teeth health, my mouth health have to do with what I'm struggling with? And that's what I'm going to share with you today. My goal is to make it very simple, to make it actionable, so you know what to do when you go home and you're at home and you're thinking every single day, what can I do to improve my health? But also, what should I go and find out more about? And that's what I'm going to share today. So I'd like to start, first of all, by talking a little bit about how I got to where I'm at. I do want to introduce this concept of, living well. And this is really my platform now, is helping people live well in many ways. But let me tell you how I got there. I am a general dentist, and I was raised in a dental family. My father is a dentist. He's still practicing in his 70s, and he's literally had 2 sick days in his entire career. So that's how I thought it went, that you practice dentistry, you love what you do, you just keep doing it for forever. But that's not how it went for me. I, about 10 years in, started to get very, very sick. And like most of you may be listening to this, health concerns are something you think, well, let's find some answers for. So I started going to doctors. I started getting tests. I started getting MRIs and scopes and all of the things that you do. And I ran into a whole lot of no answers, no explanation. Some of my concerns were my gut health. So I had really a lot of gut issues, and I had them starting clear back in my teen years. I just thought this was something that I was going to have to suffer with. So I was going through a lot of changes with my diet, with supplementation, all the things that I know all of you have done as well. Started working on all of that, and it changed some, it helped some, but it didn't help a lot. So that was the first thing that really was a wake-up call. The second was my memory. I've always had a really good memory. I can always remember whatever I read. It usually just sticks. And it got to the point where I couldn't remember a patient's name from one room to the next. And so I knew something drastic had changed. The third thing that had showed up was numbness. I had so much numbness in my hands, particularly my right hand, that I couldn't hold a dental instrument very well anymore. I was waking up all night long with numbness. I couldn't sleep. I couldn't blow dry my hair. I couldn't brush my teeth. I couldn't do anything where I would raise my arms. And so, of course, everyone always says, oh, that's carpal tunnel. Oh, that's what's called thoracic outlet syndrome, something up here in the neck. So I did all the scans. I went to all the orthopedists. I went to all the doctors. And they all said, no, this really doesn't explain everything that you have going on. So I couldn't really practice. My hands were numb. I couldn't remember anything. And I had my practice for sale. And this was a real scary time for us because my husband also works in the practice. This is our livelihood. I was in my mid-30s. We had, 4 young children, and I didn't know what I was going to do. I started looking around to try to find what else could I do with the skills, the things that I already have. And I started looking at coaching and consulting inside of dentistry and different things. And in that search, I found a practitioner. I was explaining what I was struggling with. And he said, you sound a lot like me. Have you ever looked into mercury poisoning? And I just kind of laughed. I said, well, no, I don't have any, silver fillings. In dental school, we'd been taught, we had dental materials classes, and I'd been taught that there was mercury in these, we call them amalgam fillings. People often call them silver fillings. Those metallic fillings, I had learned that there was mercury in those fillings. But in school, pretty much the whole dental school talk about mercury is, yes, there's mercury in those fillings. However, once it amalgamates or combines with the other metals, it becomes stable. It's stable. It's inert. It's not a problem for you. It's not a problem for the patient you put it in. You don't have to worry about it at all. And if you tell somebody that their health could be impacted by these fillings, you're going to lose your license. So that's the entire mercury talk that I got in dental school, was pretty much that. So I just laughed at him and I said, no, I don't have any of those fillings. And he said, oh, it's not the fillings you have. It's the fillings that you've been drilling out for the last decade with no protection. Now, I had really kind of come into this place of being a cosmetic dentist. I really like making things beautiful, and I'm very artistic, and cosmetic dentistry was right up my alley. When people want cosmetic dentistry, they don't like the look of metal fillings. So I was drilling out metal fillings all day long, every day, because I was helping people to have a beautiful smile. And in their mind, that wasn't part of it. I was drilling these out, their heads literally right here, my head's right here. All of the vapors that I was releasing while drilling out these fillings was coming right into my head. And as I started researching mercury, what I learned was mercury is a neurotoxin. I knew this. Mercury is a neurotoxin, but it's going to affect the neurology. Well, think about some of my symptoms. I had numbness, I had memory problems, and I've since also learned that mercury interferes with gut function. So all of the symptoms all of a sudden made sense. I got tested, and that's what it was. Mercury toxicity off the charts. I was shocked. Again, I hadn't even considered that this could be a problem. No one had ever told me that as a dentist, this was a risk of my profession. No one ever told us that. No one ever talks about that. Still to this day, no one talks about that in dentistry. And I was a little frustrated, but I was also concerned. I thought, well, I would like to continue in my career if I can. And the doctor said, there's no way to do this unless you're able to get the mercury out. You have to get it out. And if you continue to put it in as rapidly as you're getting it out, then you're never going to get better. So I had to start doing some research, and I'm all about finding answers. That's just kind of my personality. If I have something that I can't answer, I'm just going to look and research until I do. And I started researching, and I found an organization in dentistry that I had never heard of, didn't even know they existed, that actually had an entire protocol for how to remove mercury fillings safely for both the patient and the practitioner. So I enrolled in the course, I learned how to do it, I bought the equipment, and I started doing that kind of removal in my practice. What does it look like? Well, there's a lot of barriers, meaning we cover the patient, we cover the face, we cover the body. We use something over the nose. We use a great big vacuum at the base of the chin, just to try to get all those vapors dealt with before they get into the patient or the person that's working on the patient. So I started doing all of these protocols, and it was very obvious to my patients that I was doing something different. This is not the norm. So they would start asking questions. Well, what are you doing? And why are you doing this? And so I would share my story. And they were always glad that I was doing it, because if it was going to be beneficial for me, it was going to be beneficial for them. Obviously, all of those mercury vapors and mercury chunks and everything else that we were releasing during that appointment, they were going into them as much as they were me. I was just getting the toxic load because I was getting everybody's fillings, not just one person's fillings, but it was very beneficial for the patient as well, obviously. So they started sharing what we were doing with their doctors, and their doctors started reaching out saying, hey, we've been looking for someone who does this kind of removal. Interesting. Tell us more about it. And then we started working with doctors, and then they started asking questions like, wow, I've heard that there could be infection in dentistry, hidden infection. Do you know anything about this? Oh, and have you learned about ozone? Do you use ozone in your practice? Or, we've heard a lot about stem cells and stem cells in dental surgery. Do you do that? I didn't know what they were talking about, like at all. I didn't have a clue what they were talking about, because dentistry doesn't talk about this kind of thing. The medical doctors, the chiropractors, they know about it, but dentists don't. So I would have to go find classes wherever I could find them. And it wasn't like you just go and enroll in a school and they teach you all of these things. That's not the way it is. Even today, that's not the way it is. You have to go search out these methodologies and modalities, and you have to go to classes that no one has heard of before, and find equipment that's not really very systematized yet for dentistry, incorporate it into your practice, create systems that no one's created before. It was really an uphill challenge, but it was something that I was passionate about. So we started incorporating these things that doctors were talking about. And all of a sudden, we started seeing changes in our patients. We were not only fixing teeth, but we were helping their health. We were improving long-term chronic health conditions. And then doctors started sending more patients. The patients, they couldn't get better. And they said, I think that there's something in the mouth that's holding them back from really complete healing. So the practice started evolving and changing, not because I intentionally did it, but because there was a need. And as the need surfaced, we worked to fill it and to find answers for people. And that's really where my practice has gone. Now, the great thing about this is at home, I very much live this way. This picture is me in my garden. I have a homestead. We do all farm-to-table eating, organic growing. We raise the large majority of our food. I am pioneering an enormous gardening project, market gardening project with a local school to help bring this into the education system. Doing a lot in my personal life. And all of a sudden I could bring that personal life into the practice. I could talk about the things that I'm passionate about at home, about nutrition and about our food sources and about the way that we feed our bodies and the way we care for ourselves. All of a sudden it integrated very perfectly with all the dental things that I was doing as well. And that really has catapulted the practice to a new place. And now at my dental practice, we are seeing patients from around the world and we are caring for them in a way that helps to upright what I like to think a lot about disease or illness or our bodies as a bucket. And our bodies are amazing healing machines. But if the bucket gets too full of all of the things that you're learning about on this conference, if there's too many things stacked up in that bucket, the whole bucket tips. And that's where we get chronic disease. Now, we don't have to necessarily remove everything that's in the bucket. We're going to have stressors in our lives. We're going to have things that we struggle with. However, if we can remove enough of them, that bucket uprights and the body's able to then take care of it again. That's what we really do in our practice is we help remove enough that the buckets are able to upright. Is dentistry the only thing that is affecting chronic health? Well, of course not. And we would never say that. But it's oftentimes a big enough piece that it can upright the bucket. So those are the things I'm going to share today. Like I said, this is my Living Well platform. If you go there, I share all kinds of things for free on Instagram, Facebook, and the website. It's all Living Well with Dr. Michelle. And I'll give some information at the end as well. All right. You've already heard my journey, but I want to share a little bit more even about that journey. Like I said, I was a general dentist practicing with my father. This picture on the top, I guess that's the left. The top left is my father and I the day that I received, it's called a fellowship in the Academy of General Dentistry, and he got his mastership in the Academy of General Dentistry the same day. It was a very cool experience for the two of us to do together. What that meant is that both of us are very committed to continuing education. Both of those require hundreds of hours of education beyond what we've learned in dental school. Well, I was very educated. My father's very educated in dentistry itself. Now, the top right picture is myself at a graduation ceremony. So this graduation ceremony was for a series of courses that I have taken. The series of courses is a 9-course series. So that means I spent 9 3-day weekends taking these courses. Each of these courses is $6,000 a piece. So you can start to do your math on just the cost of the courses alone. And then the time away from practice, the time away from family, the cost of travel, all of those things. So this is at least $100,000 investment in my own education. Now, I was at the last day of these 9 classes. So anyone at the class on the last day of the 9th was very invested in their education and in their career, right? These are the dentists that are in it to be the best. I was sitting at the table at lunch with all of these other doctors who are as invested as I am in this education endeavor. And they started telling a story. One of the doctors started telling a story about a dentist in his building who wears, in his terms, a hazmat suit when he removes mercury fillings. Everybody at the table started to laugh. Now, this was after I had already gone through my own mercury journey and after I was providing the exact care they were making fun of. These are educated dentists. These are the top in the profession, and they didn't know anything about what I had just gone through and about the dangers of their own profession for themselves and patients. So I debated in my mind. I thought, do I say something? Do I not? Do I say something? Do I not? But I always say something. So, I just kind of waited for a pause in the laughter. And then I said, can I share my story with you? And I shared the story that I just shared with you. They were all very embarrassed. And I said, no, that's not the reason that I shared the story. I shared the story because I want you to know that there is a danger for you in your practice, and there's a danger for your patients in your practice. And I want you to know that it's real. So when this practitioner is using this hazmat suit, he's doing it because he wants to care for his patients better. And Again, they were very embarrassed about the fact that they had been laughing about this, but I said, my intent is just to help you understand. So that's really what I've now moved into largely. I still see a lot of new patients, so over 100 new patients a month, but the large majority of what I do now is to try to educate practitioners and patients alike about what the role that dentistry has to play in their overall health. And so that's why I'm excited to be able to share with you today as well. All right, let's see if we can get this to go forward. Okay. This is really the title or the overall concept that I want to share, that oral infection equals chronic disease. If there's something going on in the mouth, it is going to contribute to disease. Now, the interesting things about the symptoms that we struggle with. So my symptoms, numbness, brain fog issues, memory problems, gut issues, they are simply the distress signals that our bodies are sending out because of bigger root issues. The symptoms are important to pay attention to, but we don't just treat the symptoms. We want to find what is the root cause. Dentistry may often be a cause or a contributor of health and wellness issues. So this is an interesting thing. The large majority of dental problems or the large majority of chronic health issues have at least some basis in the mouth. There was a study that showed what they did is they took people who had actually died from a heart attack. They took the clot that had killed them, biopsied it, and what they found is that 78% of those clots had mouth-specific bacteria in them. What that tells us is that 78% of those heart attacks and strokes are due to something in the mouth. Again, is it the only cause? Of course not, but there is a contribution from the mouth in those situations. Research has showed that one or more root canals equals a 2 times increased risk for heart disease. We're going to go through why in a moment. Cancer, a 2.5 times increase risk if you have one root canal tooth. Again, we're going to go through why. Diseases that research has shown to be related to dental disease. You can see all of those listed. This is not me just telling things that I've seen in practice. This is research-based. Heart disease, cancer, Alzheimer's, anemia, arthritis, diabetes. Do you have any of these? Do you know anyone who struggles with these things? High blood pressure, IBS, metabolic syndrome, osteoporosis, low birth weight babies, prostatitis, pulmonary disease, lupus, cerebral vascular disease, which is a stroke, and many, many more. These are all things that research has been shown to relate to dental disease. This is one of my very favorite books. And the reason it's one of my very favorites is, well, it brings up a lot of this information. However, I believe the author gives a lot of credibility to this information for 2 reasons. Number one, if you look at who wrote the book, it's called Hidden Epidemic. It was written, I believe, in about 2019, 2017, perhaps, somewhere in that area. The author is Dr. Thomas Levy. He's an MD, but he's also a JD. Now, if you're familiar with JD, what that means he's a lawyer. The reason I love that is because he's not going to say anything in this book that he cannot back up legally, which means research-based. His quote in this book is, "Nothing else comes close to having as large of a negative health impact as undiagnosed dental infections." This is coming from an MD, not a dentist, an MD that is saying only things that he can legally back. Nothing else comes close to having as large of a negative impact as undiagnosed dental infections. That's huge. So let's talk about this. We already did a little. Is dentistry the only thing that can affect your health? Well, no, obviously not. This is the bucket concept that I talked about. Oftentimes there'll be environmental issues. There'll be structural problems. There'll be metals and toxins and infection from many different sources. On the health side, what do? We change our diet, we change our lifestyle, we add supplements, we do all the things that you're learning about on this program. You have to do enough on the health side and remove enough on the disease side to tip the balance back to the health side. The body is an incredible machine, and it will heal if given the opportunity. But if there's enough on the disease side, it can't. So let's talk about how dentistry is a huge impact on that disease side. This is an interesting thing. You can look this up online if you look up a tooth organ meridian chart. The best way I have to describe this is the body is wired in many different ways. We understand this. We know that we have an entire network of blood vessels in the body. We know that we have an entire network of nerves in the body that runs top to bottom. We know we have an entire network of lymphatic drainage systems in the entire body as well. But I don't think we talk a lot about the fact that we actually have an electrical system in the body as well. This is how our brain functions. This is how our heart beats. When we die, you see that flat line. Well, what are they measuring on that EKG? What are they measuring? They're measuring the electrical activity of the heart. In EEG, they're measuring the electrical activity of the brain. There's electrical activity that goes through the heart, the brain, the muscles, through the entire body. And that's literally what life is. When we lose that electrical conduction in the body, we die. Well, interestingly enough, the entire body is connected top to bottom electrically as well. All the organ systems are connected. And as I describe this to people, we don't think about it, but it makes sense. When your phone is dying, when your computer is dying, what do? You plug it in and it recharges. How do we recharge us? How do we recharge our bodies? Because we are electrical beings. We have to have those electrons moving through our system to keep our brain and our heart and our muscles moving. How do we recharge? Well, there's a couple of ways. We recharge through food. Food brings electrons to our system. We recharge through muscle movement because muscle movement actually activates electrons to move as well. But there are also pathways, electrical pathways throughout the body that do receive input or charge. These are called meridian systems, and this has been researched for centuries. These are the acupressure and acupuncture points that many practitioners have used in many medical methodologies throughout centuries of time. These have been mapped. This is research-based. This isn't just somebody going, I think there's something going on here. No, this has actually been mapped, and we can record electrical output of these different electrical lines. Just like you can, an electrician can go to your breaker box and can measure the output on each of those electrical circuits. We can do the same in our body. We can actually measure the electrical output in these circuits. Well, the interesting thing is that there are maps. There are kind of breaker boxes in the body where we can access these circuits. They are hands. So every organ system is represented by a point on the hand, and we can access that system to measure what's the electrical activity in that system on the hands. The feet, you may have heard of foot zoning. That's what they're doing, is actually activating and assessing those different electrical circuits through the feet. There's also a map on the ears, which is interesting, and in the teeth. Now, as I've thought about it, I've thought, well, this makes a lot of sense from a charging standpoint, because how much activity do our hands get? All kinds of activity. So we're in essence charging as we're using our hands and putting pressure into these points. Feet. How much activation do the feet get? Well, of course, a ton. As we're walking, we're activating each of these electrical circuits and recharging. Teeth. How often do you put your teeth together? People will say, oh, it's just when I chew. No, actually, it's every time you swallow, which is 1,000 times a day. So 1,000 times a day, you're recharging your system through the teeth as well. Well, the same thing exists in these teeth electrical circuits as exists in an electrical circuit in your home. If there is a short, something that shorts the line between the source point of electricity and the end point, it will short everything else on that same line. So I always talk about, let's say, the lights that are on right now in the room I'm in and the electrical outlet that I'm using on this computer right now. Those things are on one circuit. Well, if that line is cut somewhere along that circuit, if something shorts that line, let's say I plug in 3 Instapots. I've done this before. It trips the breaker. I already know this answer. It will trip it, and everything on that line will not work the same way. The same thing happens with the mouth. If there is a short that exists in the mouth on one of these lines, based on one of the teeth or one of the areas in the mouth, if there is something there, infection, metals will also short a line, just like you can't put a metal is very conductive. So it will change the conductivity of these electrical circuits. If you put metal in the middle of the line, it will block it. So metal, infection, even a missing tooth will affect the electrical conductivity of everything that's connected. So you look at this for just a moment. You can see the front teeth are related to kidney and bladder. I've had a really interesting kidney, bladder, and liver gallbladder, really are these front teeth here. Really interesting story once with a gentleman. He came in as a new patient, and I'm pretty blunt, but I'm also, I'm going to be very kind in the things I say. But as I sat and spoke with him, I just kept thinking, he's orange. He looks orange. So it was later in the visit, and I just said, I'm so sorry, but I just have to mention, has anyone ever said that you're orange? And he said, oh yeah, all the time. People ask me, do I use self-tanning cream? Because he was orange. He looked like he took self-tanning cream. And I said, well, do you use self-tanning cream? He said, no, I don't use self-tanning cream. Why are you orange then? I said, I don't know. We looked on the CT scan. What we found is that he had hit his front teeth, and he had root canals across all of these front teeth. He was chronically jaundiced because he had shorted out the liver circuit because he had a root canal on these front teeth, and he had infection around them as well. He was chronically jaundiced. His liver could not work properly because of the infection in the mouth. He was blown away. We were blown away by the fact that he was walking around orange all the time. But we see so many connections. So front, liver, gallbladder, kidney, bladder. Middle is going to be lung, large intestine, and breast. Breast is huge for these middle teeth for women and men, but lung, large intestine, spleen, stomach. So this is often gut function. That's going to be bicuspids and molars. That's also breast function, pancreas. That's all going on in this part back here. The very back teeth, which are the wisdom teeth, are related to the heart, small intestine, circulatory system, and endocrine system. What is the endocrine system? That is the thyroid, the adrenals, all the sex hormones, infertility, all of those kinds of things are related to that area as well. So these are things that are going to be important moving forward. Which areas are connected to what? All right, let's talk a little bit about dentistry in general. So interestingly enough, I would bet everybody that's on this call and listening in the future knows how to brush your teeth. You've been told by your mom what causes cavities. You brush your teeth, you care for your teeth, you try to avoid sugar, all those things. Education is at an all-time high. Spending. Did you know there's $2 billion spent on just dental products every single year alone? Spending is up. Well, my arrows are out of whack here. It's supposed to show spending is up. What are cavities? They're up. Why? Well, when you go to a dental appointment, you have an exam, they look at your x-rays, they pick at your teeth a little bit. They say, oh, you have a cavity here. You need to come back for a filling. You need to come back for a crown. And then what do? You go home, you schedule, you come back, you get the filling or the crown, whatever they recommended. And then you do it all over again 6 months from now. They're not taking care of the source. They're only addressing the symptom. Did anyone in that conversation with you talk about why did you get a cavity? How can you prevent a cavity in the future? What's in that filling material that we're going to be using? What is in that crown? How could that affect you? Does it make a difference? Nobody's talking about those things. This is why education's up, spending is up, and cavities are up, because nobody's talking about root cause. This picture is going to be really important as we continue through the rest of the presentation. The way a tooth is made, the part that you see right here, this is enamel, and it's a very mineralized layer. It's a layer of crystals. This is why it's a little bit see-through. This is why it'll gleam in the sun. It's crystalline in structure. The enamel is full of minerals in those crystals. The mineral that's in the actual tooth structure itself is called hydroxyapatite. That's just the name of the mineral that makes up teeth, the tooth enamel. It also is in bones. So similar mineral structure. Once you move inside of the enamel, you get into what's called dentin. Now, dentin is a lot more collagenous. There's a lot more collagen in that area, a lot less minerals in that area, and it's filled with tubes. There's little tiny tubes that go from the inside layer of the tooth all the way to the outside, because these are the nutrient channels. This is how the inside of the tooth that you'll see, that third layer on the inside is the pulp, where the nerve and the blood vessel and everything lives. Your body has nutrients that it's trying to feed to this tooth to keep it healthy, to try to resist cavities. So nutrients come up through that pulp layer on the inside of the tooth. They travel through the tubes in the dentin to get out to the enamel. There are literally a mile of tubes inside of every single tooth. So this dentin is just like a superhighway. There's nutrients going back and forth all the time. That's the way the dentin works. And then, like I said, the pulp on the inside has the nerve and the blood vessel. All right. So in the 1930s, they had a meeting of the minds between researchers that were studying, actually it was more probably the 1940s, between researchers that have been studying this epidemic of tooth decay, of cavities. And they all came and brought what they had through research found to influence tooth decay. Excuse me. There were three theories that were presented. The first was called the acidogenic theory. What this theory said is that when we eat sugar, the bacteria in our mouth eat that sugar as well. They particularly like that food. Then they excrete acid and other toxins. That acid, if it sits on the tooth long enough, will dissolve the minerals in the tooth. Now, you've done these things probably before. You know, you've poured Coke on the battery terminals on your car battery. What does it do? It eats it away. Acid will eat away minerals. That's just the way an acid works. So if the acid from these bacteria sits on the tooth long enough, it will dissolve the minerals in the enamel, and eventually you'll get a cavity. That was one of the theories that was presented. So this acid dissolves the minerals in the enamel. This creates a porous surface. Bacteria crawl into the holes that this acid has eaten in the enamel, and that creates a cavity. This is the acidogenic theory. There was another theory that was presented called the nutrition theory. So there's a doctor named Dr. Weston Price. Now, if you've done much research at all in the health world, you'll know that Dr. Weston Price is actually quite well known outside of dentistry for his research on nutrition. So Dr. Weston Price was a dentist, and he was the head of the research department for the American Dental Association. So he was a well-renowned dentist. He was disturbed by this increase in cavities, particularly in children at the time. So he and his wife decided that they wanted to go research indigenous societies. What that means are societies that had not been touched by the modern medical or the modern diet, the way that we eat today. So they wanted to go find these indigenous societies that were still eating the way that their ancestors had eaten. They wanted to look at what they were eating, and then they wanted to look at their health. So the cool thing about Dr. Weston Price, two things. Number one was the timing that he did this. Today, if we tried to find an indigenous society that hadn't been touched by the modern diet, we couldn't find one. But he could back then. In the 30s, he could find indigenous societies. So he went and studied them. But the other thing that was amazing is that he had a camera. So he was able to photograph what he found. And what he found was that people who were eating the food that their ancestors had eaten for centuries, they had better health. They had stronger bones. They had more longevity. They had wider smiles without decay and straight teeth. So he started investigating and saying, what are these people eating that's leading to these superior health outcomes? What he found is that the people were eating, and I think we're going to get to this actually in a minute. I'll tell you in a minute what they were eating. But what he found is that it was possible to create cavity-resistant teeth that did not decay because they were strong enough to resist whatever acid happened to meet the tooth. This was really interesting. The idea is it builds a resistant or a roof over the tooth, so it doesn't matter what you put in the mouth or even honestly how you care for your teeth. Kind of revolutionary. He presented this. The third theory that was presented was a hormone theory, and Dr. Melvin Page discovered that when hormones are out of balance, teeth start to decay. We see this particularly in two demographics: teenage kids. How many of you as a teenager or have had teenagers that just had massive cavities at the time? And pregnant women. So when hormone changes started to happen, what happens is, remember that dentin, those tubes in the dentin? Well, typically there's a fluid flow from the inside out. So it expels things that are on the outside of the tooth. The fluid flow flows outward, pushes everything off the tooth, and it's like an internal cleaning system. Well, when hormones are out of balance, the system reverses, and you actually get internal fluid flow. So literally the fluid brings the toxins and bacteria and acids into the tooth and accelerates the progression of tooth decay. This was really interesting. These three researchers came and presented these theories. What do you think won? What do you hear? If you eat sugar, you get cavities. If you don't brush your teeth, you get cavities. Do you ever hear about the nutrition piece? You can have cavity-resistant teeth or hormones. Hey, your tooth isn't doing you any favors right now. It's actually creating more decay. No, we didn't hear about those because they were voted down. The only one that we heard about was acid equals cavities. Brush your teeth, don't eat sugar. So what do? Well, we're going to take this one step at a time. So let's first of all talk about how do we clean our teeth, because it is important to clean teeth, particularly as we're reversing some of these nutritional and hormonal deficits. I talk about cleaning the outside once a day the right way. Do I care if you brush your teeth twice? No. Do I brush my teeth twice a day? Yes. Why? Because I just don't want to go to bed with that on my teeth. So I do brush twice a day. But honestly, if you're brushing right, you only need to clean them once a day. We're going to talk through these different things. So from a cleaning standpoint, you are only going to use a soft toothbrush. Hard toothbrush is used for cleaning your toilet and cleaning the oil off your driveway. That's it. Those are the only two uses for a hard toothbrush. It will damage teeth. You're going to use a soft toothbrush, and you're going to use it just like I'm showing on the screen. You angle those bristles so they go slightly up underneath the gum. You vibrate back and forth, and then you sweep that down and away from the gum line. You move to the next area. You angle it slightly, vibrate, and you sweep it down. This is easy to do. You just go systematically through the mouth, and you're going to clean everything away, only soft. Now, what do you put on that toothbrush? I highly recommend that we put a tooth powder with hydroxyapatite. Remember that word? That is the mineral that your teeth are made of. So if you have had acid on the teeth, if you have had a porous surface because of acid or because of a lot of sugar, because you're not taking care of your mouth, or because of some of these hormone changes, if your tooth is more porous, we want to fill those pores up with the thing that your tooth is made of. That's hydroxyapatite. I couldn't find a good product, so I actually formulated my own. It's a tooth powder that's hydroxyapatite. It's clay-based. It only has essential oils and xylitol. People will question, why do I use xylitol as a sweetener? The reason I do is because xylitol cannot be consumed by bacteria in the mouth. So it is actually it creates cavity-resistant mouths. So we have xylitol, which will help prevent cavities, as well as hydroxyapatite that helps rebuild the teeth. If you look at your toothpaste tube, I want you to just read the ingredients. People say, well, I don't eat it. I'm going to tell you, you do. There's no way you cannot eat that, because there's always going to be some that mixes with your saliva. The saliva is going to get swallowed while you're brushing your teeth. You are eating your toothpaste. Any of those chemicals listed on that tube, you are eating. Do you really want to eat them? Look at them and see. Do you really want to eat those things? My contention is no, because they're very dangerous. There's a lot of things in there that are actually going to kill off the bacteria in your gut, the healthy gut bacteria, because they're disinfectants. There's a lot of things you don't want. So you only want a tooth powder that has hydroxyapatite, excuse me, the thing that your teeth are made of, and gentle cleaners with very natural sweeteners or flavoring agents. That's all you want. Something very, very basic and simple. So check out that tooth powder. Hundreds of thousands of people are using this tooth powder and loving it now. They say it feels just like I left the dentist. My teeth are so clean, but they don't have all the side effects of the chemicals that they just put in their body. Tongue scraping. It's not optional. Why? The tongue looks like a shag carpet. Have you ever looked at your tongue? Oftentimes that's where fungus is harbored. So if you have an issue with candida, it's because you're not cleaning your tongue. A lot of times it's because there's some things harboring on that tongue. This is something that's been done in India through Ayurvedic practices for centuries. It also helps to balance the gut biome. It balances a lot of things. You should be tongue scraping once a day. So I recommend doing it at nighttime, because a lot of times you're going to have a buildup there. I do it in the morning as well, but at least once a day, you need to be scraping your tongue. One of my favorites is by a company called Breath RX. But honestly, I have 3 different versions. I use them all. As long as you're able to get off what's on the tongue, you're going to be fine. Does a toothbrush do it alone? It does not. Do an experiment. Go brush your tongue, then go tongue scrape. I think you're going to be shocked at how much is still on that tongue once you've cleaned it. All right, clean in between. I'm going to tell you right now, I don't even care if you floss. And I'm a dentist and I'm saying this. I don't care if you floss, but you have to clean in between some way. So you can use some sort of a water flosser, a floss holder, a floss pick, something to get in between there at least every few days. Now, one of my favorites is called a water flosser, a shower flosser. You can see it in the upper left corner here. It connects between the shower head and the wall. So it diverts just part of the water during your shower into this water flosser head, which means you're already wet. It's already messy in there. You don't have to pull something out on your counter. You're already showering. People love this. It works great. It also works great to clean the grout in your shower. And it's just an easy, simple thing to add as a habit in your life. It just connects in the shower. You're in the shower. You spend an extra minute water flossing your teeth before you get out of the shower. Everybody likes an extra minute in the shower anyway. Give it a try. All right, let's go to diet now. So from a tooth cleaning standpoint, I don't spend much time there because honestly, you know how to do it. Remember, education's up. Every single one of you knows how to brush your teeth. You don't really need to know more. I've just talked about a few little, picky things that I want you to focus on. But now let's get into the nitty-gritty of this. First of all, how can you strengthen your teeth by what you ate? This is Dr. Weston Price again. So this is a picture that he took when he was visiting those indigenous societies. If you can see these two brothers, these are brothers. They were raised, so they have the same genetics, but the brother on the right that's missing teeth already, he had started to eat a modern diet, a lot more sugar, a lot more processed dairy products, packaged foods, those kinds of things, whereas the brother on the left, who's a little older, had stuck with their indigenous ancestral diet. You can see the change in just these boys alone. This is rapid. This is a rapid change when we have diet modifications, and we're seeing it today. One of the things that I always point out is the number of people who have crooked teeth. Braces are something that's almost like a rite of passage. Why? It doesn't have to be a rite of passage. It's because our mouths aren't big enough for all the teeth that should be in them anymore. Why? Because of nutrition. The first bone that's affected by malnutrition is actually the upper jaw. The upper jaw forms too narrow, the lower jaw forms too narrow, and the teeth are crooked. We then go into all sorts of things that we're going to talk about at the end, which involves growth and development and sleep issues and airway problems and all sorts of things. This all starts with nutrition. What Dr. Weston Price found is that those that had better nutrition, what did it mean? What did that mean? Those that had better health were eating 4 times the amount of water-soluble vitamins. That's vitamin C, that's vitamin B, and they were eating, and calcium and other minerals, 4 times those. They were eating 10 times the amount of fat-soluble vitamins. What are those vitamins? Those are vitamins A, D, E, and K. These are the vitamins that I like to think of them, they're the gatekeepers. They're the ones that open the doors to our cells and escort all the minerals in, particularly vitamin D and vitamin K. Without those vitamins, the minerals, even if you're supplementing with minerals, you're very conscious of it, they can't get into your cells. This is, interestingly enough, why we use an oil-based salad dressing on a salad. Because if you don't have the fats, you aren't actually getting the nutrients out of that salad into your cells. Isn't that interesting? So you should always be using some sort of an oil on a salad. Otherwise, the vitamins and the minerals in that salad itself are not getting into your cells. These are fat-soluble vitamins. These are things that escort those minerals in. And he found that this was the difference in those that were healthy and those that were not, as they were eating 10 times the amount of these. So where do you get them? Vitamin A. Vitamin A comes from animal sources, such as egg, meat, dairy products. However, we always have to have a little bit of a disclaimer on that. That's not pasteurized dairy. That's not factory-farmed meat and eggs. Those are things that are grown and raised the correct way so that the actual fats are the good kind of fat you want, and they don't have all the chemicals and other byproducts and hormones along with them. So it's tricky in our world. I've heard it said that we are the most overweight, malnourished society we've ever had on the face of the planet. Think about that. Overweight, malnourished. How could those two things go together? Because we're eating food, but it's not nourishing us. So we do have to be careful about sourcing for these things. Beta carotene and a precursor of vitamin A also comes from green leafy vegetables and intensely colored fruits and vegetables. So carrots, peppers, colored peppers, those kinds of things. That's where we get vitamin A from. Vitamin D. Vitamin D, the body itself makes vitamin D when it's exposed to the sun. So people say, I'm out in the sun a lot. I really don't need to supplement this. Well, research has shown that you need to be in the sun at about 1 p.m. for an hour a day naked in order to get enough vitamin D, because we just don't get it the rest of our lives these days. So if you're out in the sun that much, if you're not wearing long sleeves, if you're not wearing a hat, if you're actually exposed, then you're probably getting enough. If you're not, you're not. You need to be supplementing. You can get it from cheese, butter, not margarine. That should be off there. Fortified milk, that's bad too. I basically want unpasteurized raw milk. There are few sources that actually can get you vitamin D. Some fatty fishes, some butter, but they're really, vitamin D, I believe, is one that needs to be supplemented. Vitamin E. This is often found in the seeds of things: corn, nut, olives, green leafy vegetables, vegetable oils, and wheat germ. However, there are a lot of problems with vegetable oils, so I like to get them from the actual nut or seed itself, not from the oil from the nut or seed. Vitamin K, This is a little bit of a tricky one because there are two vitamin Ks. There is vitamin K1 that is found mostly in greens like cabbage, spinach, other green leafy vegetables. There is vitamin K2. Dr. Weston Price actually in his research called this activator X. They have since named it vitamin K2. He determined that it was the missing factor. It was the thing that led to healthy people. Vitamin K2 can be found only typically in animal products from grass-fed animals. So he was finding this in populations that were eating a lot of grass-fed dairy in the Swiss Alps, those kinds of things. So we have to look for it in butter from grass-fed animals and milk products from grass-fed animals. Again, the sourcing is so important. I supplement vitamin D and vitamin K2, vitamin D3, vitamin K2 every day because it's just a challenge to get in our world today. And this is one of the supplements that I recommend. I don't recommend a lot of supplements. This is one that I do every single day. All right, let's talk about some potential problems. I'm going to take a quick drink of water. So potential problems. I already alluded to the dairy problem. When we pasteurize dairy, which is most of the dairy involved or most of the dairy available in the grocery store today, when you pasteurize dairy, it actually changes the constituents, the mineral constituents in that dairy and turns them into an inorganic form. So it's not much different than just eating a rock. That inorganic form is not absorbable by the body or recognizable by the body, and it ends up just freely floating and turning into things like kidney stones, gallstones, tartar on your teeth, plaque in your arteries. So when you're using a pasteurized dairy, it also changes the phosphorus calcium balance in the blood. And oftentimes the body has to pull calcium from your own bones in order to balance what this dairy does, because it's actually acting in an acidic way in the body, even though it's alkaline. I know this. These are kind of some confusing concepts. I'm trying to simplify. Basically, pasteurized dairy is worse for you than no dairy at all. So it's better if you don't have any dairy if you're going to use pasteurized dairy. Try to find raw. I know it's not available everywhere, but it is the best way to go if you're going to use a dairy product. The grain problem. Grains are fabulous, right? They're the staff of life. However, we have forgotten how to handle them. Pretty much every society up until the modern today society of about 1950s on has soaked their grains before they use them. Why? It takes longer. Why would you do something that actually takes longer to do? Because what they know is that soaking inactivates something called phytates, which are anti-nutrients on the outside of that grain. That phytate makes minerals and nutrients unavailable to your body that's in the grain, but also that's eaten along with the grain. So let's say you have a beautiful salad along with a piece of bread that has been made with unsoaked, fermented, unsprouted grain. Well, that grain is actually going to make it so you're not absorbing nearly the amount of nutrients out of the salad that you ate along with it. So how do we overcome this? We soak our grains. This is easy. You plop it in a bowl, cover it with water, and let it sit overnight. That's simplifying a little bit more of a complex answer, but that's basically it. Every single loaf of bread made prior to about 1950 was made with a natural yeast. Why? Rapid rise yeast wasn't a thing. It wasn't possible. So every single loaf of bread had to be made with a natural yeast process. That natural yeast process slowly soaks and ferments these grains and changes these anti-nutrients. So the nutrients are available to your body. There's been a lot of changes in grains just from a hybridization standpoint as well. Again, this is a long conversation. The short of it is soak your grains, cover them with water before you use them, and use sourdough for truly sourdough fermented breads to avoid the issues with these grains. What Dr. Weston Price found is that these were two of the biggest issues happening, the changes in dairy and the changes in grain that were leading to a lot of cavities. Now, the third is the vegan problem, and a lot of people want to throw a lot of tomatoes at me when I say this, but it's very difficult to get all of those fat-soluble vitamins without eating any animal-sourced products at all. It's almost impossible. So you definitely need to supplement for sure. The other issue is that often a vegan diet is very heavy on grains. Well, if those grains aren't being handled properly, there are going to be a lot of anti-nutrients. So your diet's almost working against your nutrition at that point. So if you are vegan, and some do, my very best friend is, for ethical reasons of her own, and I support and will always support that in her. But I'm very careful to tell her, you need to be supplementing and you need to be aware of the grains that you're consuming for this reason. All right, so that's the clean your teeth, feed your body part. Now, this is the part about how in the world can dentistry affect your overall health. And this is the one that we really raise a lot of eyebrows at. There are 4 ones that I talk a lot about: root canals, infection where teeth were removed, or another word for that is bony cavitation, mercury fillings, and poor sleep. All right, let's dive into the root canal issue. Remember, I told you that slide where we talked about enamel is the outside layer. It's the mineral layer that we see. The next layer in is the dentin. There are a mile of tubes. They're nutrient channels, feeder tubes going from the nerve and the blood vessels on the inside all the way to the enamel on the outside. That's what a tooth is made up of. When a root canal is done, what happens is the nerve portion of the tooth, the inside portion of the tooth, is accessed. It's cleaned out, disinfected on the inside of the tooth. The disinfectant of choice is bleach, just so you know. That's what's used to disinfect inside of a root canal. The bleach is supposed to eat away some of the tissue as well as kill the bugs inside of the tooth. So that tooth is disinfected, and then it's filled up with a material called gutta percha. It's a rubber-like material it's from a tree in the Amazon, and it's kind of rubbery, and it seals. That we also use a sealer. Dentistry also uses a sealer that kind of glues this gutta percha in place. Now, the concept is great. It really is. The tooth is filled up, the pain goes away, you put a covering on it, a crown, something over top of it, and you still get to keep the tooth in your mouth. You get to smile with it, you get to chew with it, you get to use it, you get to do all these things. It's a great concept. The idea is fabulous. I just wish it worked. The problem is all of those tubes. They're too little. It's impossible to clean all of that mile of tubules inside of every single tooth. So what happens is dead tissue remains in those tubes, but bacteria also does, particularly if the tooth was already infected before the root canal was done. So if you already had an abscess, you already had a swollen face, you already had any of these things, well, that tooth was full of bugs before the root canal was done. So when that happens, we seal it off. Glue, this gutta percha material, seals it. It's like backing up a sewer system. Those tubes are full of dead tissue and bugs. And if they're not full of bugs already, they're going to be soon, because dead tissue always attracts bacteria, always attracts bugs. So those tubes are full of dead tissue and bugs. The body's immune system can no longer get there to fight them because we sealed it off. Remember, that's what the root canal procedure did. It removed all the blood vessel and nerve tissue on the inside of the tooth and sealed it. So now the immune system cannot come up through the center of the tooth, through those vessels, and get out and kill those bugs. It cannot keep the tooth healthy anymore. We've backed up the sewer system. However, those bacteria, they start to eat the dead tissue. They start to flourish, and they start to dump all their toxins outside of the tooth. So it starts to eat away the bone surrounding the tooth itself. We can see these on a dental CT scan. If they're large enough, we can see them on a traditional dental x-ray. We can't always see them, though, and I believe I have a picture to show you here in a minute about this. Over 95% of root canals harbor infection because of just what I told you right now. Not because anyone did anything wrong, not because they did the procedure incorrectly. It really isn't a fault of the practitioner at all. It's a fault of the procedure and the concept and the fact that we forgot that these teeth are full of tubes, and those tubes will harbor bacteria as well as dead tissue. So over 95% harbor infection. Why only 95%? Why the other 5%? Well, there are some bodies that the tooth was not infected. It was a trauma situation, and it hasn't infected yet, but it will at one point. Over 35% of the population has at least one root canal. So that means at least 35% of you listening have something in your mouth that could be causing or contributing to your chronic disease situation. This slide I need to update. It's actually not 20 to 25 million root canals. It's 30 to 35 million root canals are performed in the United States per year. That means 30 to 35 million more people per year have the potential for an infection that's low-grade, chronic, and affecting their health. That means 35% of the population at minimum has an asymptomatic dental infection. What do I mean by asymptomatic? This doesn't hurt. The nerve's gone. Sometimes it does hurt. So that's not a true statement across the board. Sometimes this does hurt. People will describe it often as an aching, like it just never quite felt right. That's how they describe it. Or ghost pain, just didn't just didn't never feel quite right even after the root canal. It's supposed to not feel anything, but it still does. Some people explain it like that. Others have no sensation whatsoever because the nerve's gone, remember? And bone is actually very lightly innervated, meaning there's not a lot of nervous system in the bone. So as that bone is getting eaten away by all those bacterial toxins, it doesn't really hurt. I have found holes in people's jawbone the size of a quarter, and they had no idea it was there. So how do we find it? I find it on a cone beam CT scan. Now, this is a picture. This is an old cone beam CT scan. They're so much better now, but I always have to use this one because this was the first one that woke me up to this situation. The x-ray on the left is a typical dental x-ray. I'll always remember this patient. I remember the room she was sitting in my office. I remember what she looks like. She complained of pain on a root canal on the upper left. And she said exactly what I explained. It just has never quite felt right. So I took a traditional dental x-ray, which is what we're looking at over here on the left. It looks fine. If you were to take this to any dentist anywhere and ask them, how does this root canal look? They're going to say, that looks fine. It's clinically acceptable. It's fine. Well, I had just gotten a CT scanner, the CT scan machine in my office, and I said, let's do a CT scan. I'm just curious. I want to find out what we're going to see on this. So I took a CT scan, and what I found, I don't know if you can see my cursor right here. This is the tooth that I took an x-ray of that has a root canal. This whole area right here is destroyed bone. Again, this one's about the size of a nickel. The entire area of bone over not only the root canal tooth, but the one next to it was completely destroyed. I couldn't see it. I just couldn't see it. We cannot see it on traditional x-rays. So cone beam CT scans, 50% better at finding dental infection. I disagree with my own slide. I think it's probably about 98% better at finding dental infection. I can see everything on a CT scan. It's 3D. I can turn you upside down. I can turn you inside out. I can go down, up and down your tooth in just tiny little slices. I can see everything. I can see if there were nerve canals that were missed. I can see everything on a CT scan. This is why this is such an epidemic. We can't see them. We don't know that it's going on. Every single day, people ask me, why did my dentist not tell me about this? They couldn't see it. It's not that they're doing anything wrong. They just simply couldn't see it. You have to get a cone beam CT scan. This is a dental specific CT scan. I'm going to be saying this over and over and over again. All right. The second one that we need to talk about is a bony cavitation. Now, bony cavitations are areas in the bone that didn't heal after a tooth was removed. Interesting. Which teeth are most frequently removed? Wisdom teeth. How many of you have had your wisdom teeth removed? Probably 80 to 90% of you have had wisdom teeth removed. When a tooth is removed, a few things have to happen correctly. The ligament that's surrounding the tooth has to be intentionally removed, and it doesn't just come out naturally with the tooth. It has to intentionally be removed. All the little bone pieces, all the little tooth chips, everything has to be intentionally removed. If anything is left behind, it acts like a sliver in the bone. And if you get a sliver in your finger, it will swell up. The body tries to push it out, but it won't heal as long as that's in the tissue. The same thing happens in the bone. If that ligament, if that tooth fragment, bone fragment, whatever is left in the bone, the body can't heal. It will form kind of the same as it does on the sliver. It'll form a cyst structure around whatever that irritant is, and it will not allow bone to heal. Bone cannot heal inside of that. Well, then that tissue will die. The ligament, everything dies inside of this cyst, and you have a dead zone in the bone that's unhealed. We talked about this. Dead tissue always attracts bugs. So microbes of all varieties, we biopsy these and we find bacteria, virus, fungus, parasites, the craziest things you could ever imagine in these bony areas. What do we do about it? We actually go back in and clean these out again. This is hugely related to inflammation. So if you have arthritis, if you have adrenal or energy issues, if you have brain fog, if you have low thyroid, if you have Hashimoto's, if you have autoimmune disease, there is such a correlation between these areas and all those things that I just listed, because this leaves your body in a constantly inflamed state. If your body is constantly inflamed, the immune system is constantly working. And when it's constantly working, it gets confused and overwhelmed and tired out and worn out. And you use up all of your stress dealing with hormones because you're dealing with this nonstop. So we see so many autoimmune diseases based or related to areas where you had a tooth removed 3 decades ago and had no idea that there's a chronic long-term infection there. How do we find these? cone beam CT scan. It's the only way. And a dentist that knows what they're looking for when looking at these. What's in these areas? These are actual biopsies from patients. These are things, parvovirus, all sorts of strep, cytomegalovirus. Over here, Campylobacter, really bad, entamoeba parasites. These are actual biopsies that we've done in these areas, and these are bad bugs living in these holes. Okay, let's talk about mercury fillings now. We're just kind of checking off those lists. The root canal and the cavitation, or the bony areas where they didn't heal in the bone. It can happen for any tooth, by the way. Those are the hidden infections. Those are the ones that will take you down without you knowing. Mercury is a little less hidden. You can see it, right? Well, I want to talk to you about things that I can talk to you about. I actually can't tell you that this could affect your health. I still could lose my license, but I can tell you some things, and I will tell you those things. Number one, dentally, these mercury fillings are metal. So they're an amalgam or a combination of silver, copper, mercury, a whole bunch of different metals. Well, what does metal do when it gets heated up? It expands. And what does metal do when it gets cold? It contracts. So this is inside of your tooth. What it does is cause cracking down the tooth because it's expand, contract, and it causes cracks in this crystalline enamel structure. So dentally, what we find is cracked teeth around mercury fillings. We also find cracked fillings, the fillings themselves cracked, and we find cavities underneath these because as they expand, contract, they form these little gaps between the filling and the tooth itself, and bacteria crawl underneath there, and you get a cavity underneath the filling. So from a dental standpoint, they really beat up your teeth. They're great to get removed. From a health standpoint, I can tell you because research has showed that mercury leads to brain fog, nerve problems, low energy, allergies, gut issues. Mercury is related to all of those, and mercury is released from these fillings 24/7. So what do? I tell people all the time, it's better to leave them in place than to have them removed not safely, because you're going to get a huge influx of mercury if you don't do it in a safe way. Please find someone who is, it's called SMART certified. SMART certification has a whole bunch of protocol for how to remove these fillings safely and not get more mercury into you. That is absolutely key. So make sure it looks like this when you're getting it done. All right. Can you heal teeth? People ask me this all the time. Can I heal my teeth? I see it on the internet. People are posting pictures. I can heal my teeth. My answer is yes, absolutely. But it goes back to that picture we showed at the very beginning. Remember which portion is the mineral portion of the tooth. That's the enamel on the outside. So again, remember, how is a cavity formed? If bacteria sit on the enamel, or if acid from bacteria or acid from your diet, or if your body just needs those minerals, all of the above, you could have minerals be dissolved from those teeth. Actually, I'm going to talk on that just for a moment because I just briefly glanced off of something. If you have absorption issues, meaning if your gut is not absorbing nutrients properly, your body, if it's not getting the minerals it needs, it will actually steal them or mine them from other structures in the body. Well, guess what two ready-made sources of minerals in the body are? Your teeth and your bones. So if you're getting tooth decay, if you're getting osteoporosis, most likely you have a mineral absorption issue, and your body's having to mine those minerals because you're not absorbing enough through your gut. So that's where you start working on gut function. I talk a ton about this, but gut function, gut absorption. So anyone that's starting to get a lot of cavities, particularly around the gum line, the first thing I say is your gut's not working, is it? And they'll say, how did you know? Because I know your body's stealing the minerals from your teeth right now to feed you. So let's feed your body and it will stop stealing minerals. So that's a really big cavity prevention piece, is let's stop stealing minerals. Let's actually get the gut working so that it can absorb what it needs. But now let's get back to, can you remineralize? So if your body's been stealing minerals, if acid has been dissolving minerals, can you put minerals back into the tooth? The answer is absolutely. The key is we have to put back what was lost. People will often say, well, that's when fluoride comes in, right? Well, let's talk about what fluoride does. Fluoride actually strengthens the crystal structure of the outside of the tooth. It strengthens the enamel. That could be good, right? It strengthens it, but it also makes it slightly more brittle. Here's the issue. It doesn't just affect the tooth. Remember, bones are made of the similar mineral structure that teeth are. So it's also affecting the bones, making them stronger and more brittle. There's research that shows higher incidences of hip fractures in areas that are highly fluoridated. So the more fluoride you have in your system, the greater chance you have of having a brittle bone. I'm not okay with that. There are other issues with fluoride. Fluoride interferes with thyroid hormone activation because fluoride and iodine's key for thyroid hormone, they're cousins. Fluoride's the meaner, bigger, older cousin, and he bullies iodine out. So low thyroid levels could be related to fluoride. There's so many things, and it makes me scratch my head because teeth are not deficient in fluoride. When you get a cavity, they're not deficient in fluoride. Remember, we talked about what they're deficient in. The minerals have been absorbed, been dissolved by acid or the body. Minerals are missing, not fluoride. Minerals are missing. So all we have to do to remineralize teeth is put minerals back. Which mineral is that? Hydroxyapatite. Remember, that's what the teeth are made of. We put back what the teeth had originally, not what they never had. They never had fluoride. Why have the side effects and all the other toxic effects of fluoride for this little benefit when there's something else to use that has no side effects? Let's just put hydroxyapatite back on the tooth. That's why I love my hydroxyapatite tooth powder. Can you remineralize? Yes, if the cavity is still in the outside layer, in that mineral structure, crystalline structure. Once the cavity's moved into that tubule area, remember I was talked about how it's a superhighway, it's spread everywhere. Once the cavity is moved down into that dentin area, it's going to be much more difficult to heal that area. So we try to catch cavities when they're small, little, so that we can put minerals back in. And that's so absolutely you can remineralize a tooth. All right, I know I'm moving quick, but I want to get to your Q&A in just a minute. So I've got to cover my last thing here. We've got to talk about sleep. And why is a dentist talking about sleep? Let's talk about it. First of all, how common are these issues? 2/3 of people have some sort of a sleep disorder, and most of us don't even know. 90% of us have no clue. 1 in 5 adults have mild sleep apnea. 1 in 15 have moderate. That's a lot. Most of us have no clue that we're having a sleeping issue. Honestly, this is one of our greatest public health crises. It leads to a weakened immune system, increased cancer risk, metabolic, endocrine issues, heart disease, diabetes, Alzheimer's. But this is the big one I like to point out. If you are not getting the oxygen you need while sleeping, you will have a 20% shorter life expectancy. This is shown by research. What that means is if you were going to live to 80, you're now going to live to 60. If you're going to live to 90, you're going to live to 70. Are you okay giving away 20% of your life expectancy? I'm just simply not. So let's talk about what we can do about it. Let's go past that one. Sorry. All right. Dental screening. This is why a dentist needs to be talking about this. We can see so many things, but you can see this at home. I want you to look at these pictures. When you say ah, the tongue should be in the mouth and you say ah. You should see what looks like on this far left. You should see a throat. We should see tonsils if the tonsils are still there. We should see the uvula. We should see all of that. Go all the way to the far right. When that person is saying, ah, all you're seeing is a swollen tongue, zero throat, zero room for air to get through. So this is something that we look at in just this initial exam even. Where this is called the Mallampati score. Where is the Mallampati? We want you to be 1, 2 at the very minimum. How do we diagnose these issues? A lot of times people have already diagnosed. By the time they've come in to see me, they say, my wife sent me in because I snore, or I wake up all night long. I wake up like 7 times a night to go to the bathroom, or I just can't go to sleep. I have to lay there for hours, or I'm taking Ambien and I have for years and I don't dare go off of it, even though I know it's not good for me, but I simply can't sleep. Or I wake up and I slept, but I don't feel like I did. I'm super tired. I just feel groggy all day long. These are all self-diagnoses of sleep issues. How can you officially diagnose it? You don't have to go to a sleep center anymore. We can actually do a home test now. Oh, too far. We can do a home test now. We even have a brand new one that's just a ring that you wear on your finger, and it can give actual sleep diagnosis just with that. We can send it to you in the mail. You do it home, you send it back, and we get an actual sleep diagnosis off of it. Is it important to have the diagnosis? I believe it is because it's measurable. Then we can tell if you're getting better or not. Sometimes we forget how bad we were when we're better. We go, I don't know if it really helped or not. Let's measure again and see. So it's nice to have a measuring tool. However, you don't necessarily have to have it to proceed through some of the treatment options. What are those treatment options? Well, most people know of a CPAP and that's it, right? They know that, okay, we can strap this thing on my face and it's going to blow oxygen down my pipes so that I can get enough oxygen. Huge issues with this. First of all, it's not addressing the source whatsoever. It's not addressing why is there not enough room for air to get through. That hasn't even been talked about. Second thing it does is when you supplement something artificially to the body, whether this be hormones or other nutrients or oxygen, when you artificially supplement that to the body, it turns off the body's own internal feedback mechanism, so the body stops telling itself to breathe because you're giving it the oxygen it needs. This affects breathing efficacy even during the daytime. This has some spillover effect. So now your body doesn't have to breathe because it's getting the oxygen forced down the tubes. So it kind of stops doing it all the time. You can start doing some sleep hygiene, where you're doing blue blocker glasses and take all the electronics out of your room and melatonin at night and cool the room down. I believe in all of those. I don't think that any of those are bad ideas. However, if the source hasn't been addressed, they may not actually take care of the problem. A mouth appliance that moves the jaw forward. That's another that often people will hear about. You wear a mouth appliance, it moves the jaw forward. What is that doing? It's opening up this section right here. That's your airway. It's making more room. That's getting closer to addressing source now. That's getting closer to it. But the problem with the mouth appliance that moves the jaw open, it's kind of like a knee that's been hyperextended or a shoulder that's been hyperextended long term. This is, in essence, hyperextending the jaw all night long. There are ligaments that hold all these structures in place. And if you hyperextend for too long, you'll get ligament laxity. You'll overstretch the ligaments and the jaw starts to have jaw joint degeneration. Research shows about 2 years out. Do you really want to do that? Let's just address source. So what can we do? Well, one thing is we can use a laser to make more room in the airway. If you do that test and you look in the back of your throat and you can see no throat, we can actually shrink up some of those tissues. Interestingly enough, oftentimes those tissues are swollen because of all the things we just talked about. Dental infection. Think about if you have infection in the wisdom teeth areas. Where are the wisdom teeth areas? Way back in the back of the mouth. So that will cause swelling back here in the back of the throat. Remember that picture, how swollen that tongue and everything was? Often it's dental infection that's causing it. So that's the first thing we address is there infection in the mouth that we need to clear out, that we need to clean up? How do we clean up? We didn't talk about that much. How do we clean up failed root canals? There's only one way. Nobody likes me to say it, but there's only one way. We have to remove that tooth with all of those infected tubules. We remove the tooth, we replace it with a ceramic dental implant. It's a whole nother talk. I'm sure there'll be questions about that one. We replace it with a ceramic dental implant. Wisdom tooth areas, other tooth removal areas, we clean them up. We go back in, we disinfect them, we fill them up with stem cells so they'll finally heal. So that's the first treatment for sleep issues is, do you have infection we need to address? Do you have mercury fillings that we need to remove? Because it will affect brain function. It will affect the way the brain is stimulating the body to breathe, actually. That's all first. Then we say, okay, can we use a laser to shrink things up now? Now that the infection's gone, can we shrink up that excess flabby tissue? Do we need to actually do a tongue tie release? Is the tongue in the wrong place? Is it sitting down and back because it can't move up and forward? We assess this in children as well. Or do we actually just need to make the mouth bigger? Is there just not enough room in your mouth for your tongue, for all these tissues? We can do all of those things. In a child, look at the difference in this boy. Look at his eyes. Look at his eyes. Look at his jaw position. See how far back the lower jaw is? Because of growth and development, probably some nutrition issues, not because mom didn't feed him, but because the food we feed them doesn't have the nutrition in it anymore. This boy isn't sleeping. You can tell in his eyes, he's tired, he's fatigued, he doesn't feel good. His jaw is so far back that it closes off the airway. So we actually do growth and development appliances in children that help the area to grow the way it should. This is not genetic. This is not genetic because it will take multiple generations for these kinds of changes to show up. They are showing up in less than a generation. This is environmental. We are not getting the air we need, but jaws and mouths are not growing like they should because of environmental factors. Nutrition is a huge one. We need to identify this early in kiddos. Look at this young man, the difference in his face from left to right. Look at the difference in his mouth posture. If you are mouth breathing, if you have the short upper lip, any of these things, these are all related to growth and development problems. And this young man is not breathing. Look at in the bottom pictures, the change in his jaw position. It's just incredible, the things that change in the face. And then you see them here but you feel them in the body. They breathe. They get the oxygen they need for metabolic systems. All of a sudden, the brain works better. Kids are focusing. Their ADHD symptoms are completely dissipating. They aren't wetting the bed anymore. All sorts of things go away when you can breathe. We can do the same thing in an adult. You can see the difference in this woman. It's absolutely life-changing, the changes it can make in a face, in a woman, in a life. We can change this with growth appliances, even in adults. Doesn't matter the size. You can see up top, this is a directional growth appliance for a child here. You can see the difference it's made. This is not braces. This is actually directing growth while the child is still growing. So much potential here. All right, I know I have moved quickly through things because I want to get to some questions, but I want people to look at this slide. If you want more information, like I said, there is so much information that I give away for free everywhere. Go to my website, go to all my Instagram, Facebook profiles, whatever. Take a picture of this QR code right now on the screen. If you've got your screen up, there's also a code for a free gut health guide. I talk so much about gut because I identify gut issues because I start to see cavities. There's so many connections here that I want you to really take advantage of and use this information. This is all of the places you can go find this. But I wanted to get to questions because I've been seeing people raising hands. I wanted to get to questions. I wanted to answer things that people are wondering about. So let's do that.
All right. So thank you so much for that very enlightening presentation. I think that the whole dental aspect of like holistic health is definitely often overlooked. So we're going to begin our Q&A session. We don't take questions out of chat. So for the audience, if you'd like to ask a question, what you're going to need to do is you're going to need to raise your hand. If you don't know how to do this, you're going to go to the bottom of Zoom, second from the right. You're going to see a reactions button. And you're going to click on that and then click on the raise hand function in the pop-up menu. When we take your questions, we'll take them in the order. You can ask, we're going to open this up and allow you to, ask, a number of follow-up questions if you'd like. And then, but we do want to make sure that everybody gets a turn. So here we go. We have our first question from David Ross. David, please state where you're from and ask your question.
Hi, can you hear me?
Yep.
Yes.
Yes, so I'm David from Framingham, Massachusetts. So first of all, thank you for the great presentation, very enlightening. I would like to know if you're familiar with holistic dentists in Boston area. So this is my first question. And my second question is, you mentioned about ceramic dental implant as your recommendation for root canal issue. So most of the implant done from titanium are and some of them from zirconia. I would like to understand what are your thoughts about the material of the implant. Thank you so much.
Yeah, so your first question, this may be a common question, so I'm going to give an answer that everybody gets an answer on this one for. Where do I find a dentist like this in my area? There are a couple of online directories that you can actually look at. Now, I will give a little bit of a caveat because not every dentist on those directories are going to be the exact same, trained the same way. So I now have my own directory. I've just started and I'm training doctors so that I can say, yes, they are going to talk about everything that I just told you about. So you can go there. There's always a directory on Living Well with Dr. Michelle. So go there. But the two big ones, there's not going to be very many doctors on there because we're just building right now. But the two big ones are IAOMT, and hopefully we can put this somewhere in show notes, but IAOMT.org and then IABDM. So again, IAOMT.org and IABDM.org.
Okay, let
Big
me
long words.
And so it's IMOMT.org and
IAOMT. So IAOMT.
Sorry about that. IAOMT.org and IABDM.org. All right. So I just sent that to everyone in the chat. So that's now.
That's not quite right though. It says IA. Oh yeah, that's correct now. Yes, perfect. Yep.
Okay.
IABDM. Right. Perfect. Yep.
Yeah.
Those are two directories that you can go to. Again, like I said, there's a little bit of a caveat. I don't know exactly how they're trained, but at least those dentists are more trained and at least thinking about these things. And then you can ask questions. If you go on my website, it's called Total Care Dental, I have a question list that you can ask dentists to assess, are they somebody that knows what you need to know, what you need to have them know? So you can get those questions off of there, and you can start doing some interviews. So that's the first question. Hopefully that answers a lot of questions people have about where do I find somebody. Yes, totalcaredental.com. Thank you. It's not .org, .com. Yes.
Oh, I'm sorry. .com. Wait.
Yep. Totalcaredental.com. Perfect.
Oh, that one. Okay.
Yeah. The others are org.
All right, perfect. Thank you.
Yep.
All right. So this is coming from a different David. David, please state
where we got to finish the end of his question though about implants. I'm sure that's going to be something that somebody else is going to be asking.
All
so
right,
let's finish up with dental implants. Yes, there are two types that are typically used. There are titanium, which are metal, and there are zirconia, which are ceramic. So if you're talking about zirconia, you are talking about ceramic. I just call it ceramic because people understand what that means a little bit more. The difference is that titanium is metallic and it's going to conduct electricity. Zirconia actually sits right next to titanium on the periodic table. So it's very, very strong, but it's an oxide. We use a zirconia oxide, which means it is not conductive. Now, remember, we go back to those meridian, those energy channels. If we put a piece of metal in the middle of one of those energy channels, it's going to change the conductivity of every organ system on that system. Now, the other issue with titanium is really interesting. This research is coming out of the orthopedic world because they put a heck of a lot more knees and hips and shoulders, metal parts and pieces than we even do in dentistry. What they're finding is that in today's world, we are surrounded by frequencies. We call these Wi-Fi, we call these cellular frequencies. It's all it is a frequency, which is a wave of energy that's passing through the air, in essence. That wave, when it heats metal, it heats up the metal. This is just like a microwave. This is why you can't put a metal pan in a microwave. It heats up the metal, the particles, and heats it up. It also is heating up dental implants, knee implants, hip implants that are metallic. And if it heats it enough, it's typically showing that all of these wavelengths are heating the titanium 4 to 5 degrees, which is enough in some instances to literally melt the bone around these implants. So that's one of my biggest concerns is, in the long term, we don't know what's coming in our world from a frequency standpoint. Are we going to be losing dental implants because the bone is melting away because of the heat? So it's just kind of a scientific thing. It's not even what's your belief system? It's just a reality. So I don't recommend titanium implants for that reason. They actually have been in the world a long time. Ceramic implants have been also for about 15 years in service, and they are working very well. They are beautiful because they're not black, they're white. They look great. And the gums and the bone love them. So they're a very, very good replacement for a tooth.
And just real quickly, so your recommendation based on your presentation, just correct me if I'm wrong, is that if you have had a root canal, you should have that whole tooth removed and you should just go with a dental implant and it should be ceramic based on what you're just saying?
Yes. You can choose not to have the tooth removed. That's always a choice too. It's a very back tooth. You don't have to replace the tooth, but if you're going to replace it, I recommend the ceramic dental implant.
Okay. So you have it removed and then just don't replace it if you don't need to.
Yeah, that's an option as well.
All right. Perfect. All right. Our next question is coming from David T. David, please state where you're from and ask your question.
Yes, my name is David. I'm from the Washington, D.C. area. Thank you so much. I appreciate your presentation. Unfortunately, I didn't get the chance to see the first part, but nonetheless, I was wondering if you were young and you had your wisdom teeth removed, in my case, in my mid-30s, and you have potential cavitation. How do you address that? I assume you should do the cone beam and first figure out what's what, but then what do you do if there is an issue? And then secondly, as I recall, when I took your online class for remineralization, I just want to make sure you recommend horsetail. So I just want to verify that for remineralization, or if there's something else you also recommend. Thank you.
Good questions. All right. So yes, if there is a bony cavitation, if there's an area that the tooth did not heal properly, it does need to be diagnosed through a cone beam CT scan. That is the correct first step. And a dentist that knows how to read that. That's not always a given. So make sure that somebody knows what they're looking at when they're looking at the cone beam CT scan. And then the second step is we actually go in and clean those out. I just had this done on myself about a year ago. So we access that area. we go and we find this just cesspool of bugs living in there, this hole in the jawbone. So we clean that out very, very thoroughly. We disinfect it with ozone, and then we fill it up with stem cells. And these stem cells, they're called PRF, and it's actually taken from you. We do a small blood draw from you. We treat that in a special way, and we take out the stem cells, the growth factors, the fibrin, and that's what we put in these areas so that it stimulates your body to heal. Finally, this time around, we get rid of all the bugs, and then we put something in there that's a scaffolding for the bone to grow to. So that is the way that it's treated, and there is a surgical procedure to do that. Second question on remineralization. I love horsetail. So for those that don't know, horsetail is an herb, and it has a high level of silica in it. Well, silica is also a component in the enamel, the crystals in the enamel. So horsetail is a very natural way to treat remineralization. I love it. But I've since added hydroxyapatite to my regimen as well, because hydroxyapatite can be applied directly to the teeth in the form of a tooth powder. So silica is great for internal usage. It's going to come through the tooth. It's going to help remineralize from the inside out. But hydroxyapatite in a tooth powder is going to be used from the outside in. And you're going to be able to put that right exactly where you want it. And the two combined are great for remineralization.
Thank you very much for that. Now, you mentioned the cone beam, I believe I'm saying that right, cone beam CT scan. How prevalent is that? How do we find dentists that use that to make sure that we get the proper diagnoses of these issues?
So it's going to be not very prevalent in general dentists, just across the board. Anybody that's holistic or biologic based is going to always have one. An oral surgeon will always have one. So a lot of times we are sending people in their local area to an oral surgeon's office to get that CT scan. A couple of things you want to watch for, though. You need one that's going to show a large, what we call volume, which means we want to see all the way back, where those wisdom teeth are. I love to see even the airway. I want to see your whole head. It's machine dependent. So it may be that the machine that they're using just shows this because they're looking at it for dental implant placement. So they just need to see the jaw bones. So you need to ask, do they do a full volume or a full head CT scan? Is that, can their machine actually do that? So you call and you say, do you have a cone beam CT machine? And can it take a full head scan? That's what you want to have. And then there are dentists like myself, I do this as well, that will do cone beam readings. I do it virtually, where we'll read the cone beam CT scan, and then I give a virtual report to people based on what I'm finding, because that's probably the most uncommon, is a dentist that actually knows what they're looking for on them.
And a lot of people are a little apprehensive of like X-rays and any sort of like radiation to the head or to the body for that matter. How dangerous are these CT scans?
Yeah, great question. And when you say CT scan, you think of the one at the hospital, and you think, oh my gosh, I'm going to be like glowing in the dark when I'm walking out of there. It's totally different. It's very isolated to just this area that we want. It's all digital, which is low dose. So it's low dose radiation. And then we do a couple of things in our office that counteract it. Anyone can do this at home. So we add vitamin E in the form of what's called tocotrienol. If you take that right after any sort of radiation, it will help mitigate the effect of the radiation on the body. Basically, it's an antioxidant, and it's going to change the way the radiation interacts with you. So take tocotrienols. You can just get that online anywhere. It's vitamin E. And as soon as you get any sort of a dental x-ray, and that will help mitigate that radiation effect. But this is about like being outside for an hour outside as far as radiation amount. So it's very, very small. We use low dose digital, as little as we possibly can. There's so much diagnostic value in the scan that it is worth it. But we try to mitigate the radiation dosage as much as possible and give you things to give your body help after as much as possible. But it's a trade-off that I'm okay taking because of the things that I find. Rochelle,
please state your where you're from and ask your question.
Hi, I'm Rochelle, and I'm from Long Beach, New York. This was a very comprehensive presentation, so I appreciate you for that. I think I have to watch it over a few times. There's so much information. My question is about dental implants. So a number of years ago, I had titanium dental implants that failed, and it caused neurological problems that kind of amazed me, because I'm a healthy person. I'm a vegetarian or vegan, and, no real health issues. So the implants, I got all kinds of neurological problems like brain fog, headaches. I had migraines. I was not pleasant to be around. I was like getting depressed, and the implants failed. They got infected. And as soon as they were taken out, all my issues went away, and it gave me a fear of implants. So my question is this: have you come across this? Why would this happen? And implants, I'm thinking of doing zirconian, but I'm kind of scared after my experience. So if you can address that, I really appreciate it.
Yep. I have seen this happen multiple times. Actually, we have people coming to us specifically to have their titanium implants removed for these reasons. So there's a couple of problems with titanium. The first is that conductivity. So like I talked about with the meridian systems, with the energy channels, when you put a metal dental implant in the middle of one of those energy channels, it's going to throw off the electrical conductivity of everything on that whole system, which is going to change your neurology. You're going to show up with symptoms across the board. And I didn't talk about this specifically, but that's why I pointed out right here, because this is a place that a lot of dental implants are placed. This is on the breast meridian, and I have yet to find someone who had breast cancer that didn't have either a root canal or a dental implant right here. So there is huge implication of those systems being affected by metal in the system. So that's just the first piece, is just simply it's a piece of metal. And so it changes conductivity. The other problem that we're having is that titanium is so overused in our world in general. So it's used in the hard candy coating on the outside of M&Ms and Skittles is actually titanium dioxide. Titanium dioxide is used in cosmetics. It's used in sunscreens. It's used in the bags that you get from Walmart. It's used in paint. It's used in so many things. And what we're finding is a titanium overload in our systems, because we just aren't meant to have that much titanium in us. So you have all of that in the environment, and then you add titanium in the mouth. There's also a few people who have titanium sensitivity. Not typically an allergy doesn't happen, but it's a sensitivity. So I'm so glad you got them out, and I'm so glad your symptoms resolved. That's amazing. We do recommend zirconia to oppose all of the things I just explained. They are not conductive. You're not going to have an issue with it shorting those circuits, and it's not titanium. So we don't have to be concerned about this overload or sensitivity issue. Have I seen anyone with a zirconia sensitivity? I have not. However, zirconia implants are interesting. They are actually a little harder at the beginning to integrate. Integrate means bone growing to them. They're a little harder to get that to happen at the beginning. Once they've integrated, they're solid as a rock for forever and are better than titanium. But I wonder if they are not integrating at the beginning, it actually indicates some sort of a sensitivity, even to the zirconia a little bit. But I like what happens, because what happens is the body rejects them, and it's quick, and it's not painful, and it's not infected. It's really an interesting thing to see. Doesn't happen very often, but on a rare occasion it does. And I think the body's just telling us, nope, that one's not going to work for me either. In your situation, I think all of your symptoms sound metal-based, and I would suspect that you're going to be successful with the zirconia versions.
So, okay, question. So what are the dangers of having mercury fillings removed by a person who isn't SMART certified and doesn't do it in a very clean way? One, what do they use to replace that mercury filling, and how do you detox from that mercury overload?
So the dangers of removing mercury from someone who's not doing it with the correct protocol are exponential. Because what's going to happen is the mercury vapor, first of all, is going to get in your nose. It's going to get in your brain. You're going to swallow pieces of it. And mercury is one of those toxins that just goes and finds a neighborhood to live in, and it's going to hide. And it's really hard to get rid of it. So it's going to move into the brain. It's going to move into the gut. It's going to move into other places, and you're not going to get it out. So I would prefer that the mercury stay in your mouth, in those fillings, in a slow release system, than for you to put a massive dose into your body, because you're going to have massive mercury symptoms like I had. So do not do that. You're going to find somebody that's SMART certified on that IAOMT site that I talked about. That's actually the organization that does that certification. They're going to have a whole bunch of protocol for covering you. A big vacuum here at your chin. They're going to use a rubber dam so that none of the particles or pieces get into the mouth. all those kinds of things are going to be necessary when you get those removed. You are also, this is your third question, you're also going to want to do a metal detox along with that removal. So you're going to do two things prior to the appointment and during the appointment and after the appointment. You're going to make sure that all of your elimination systems are moving. That means your liver, your kidney, everything is working before you're going to do this procedure. So that's working with a naturopath or someone that can help you with those systems. Then once you get started with close to the mercury appointment and during, you're going to use binders. What those are is you're going to get some mercury no matter what during this removal appointment. Even if somebody's incredibly safe, you're going to get a little bit of an exposure. So we want a binder, which is basically a grabber. We want a grabber on board that's going to grab any mercury that gets released. And then we want another guy that goes, okay, now it's time to dump it. So both of those things are going to be they're going to be involved in this detox that you start before the appointment, during the appointment, and then after the appointment. You want this to continue for another few weeks after. So we have a metal detox that we use. Oftentimes you can get this through a dentist that does this protocol, or you can also get this through a naturopath. You want to make sure you're doing that, so you're assisting your body in dumping anything that it does get exposed to, even during a safe removal process. So that detox is very important.
And well, given that you were exposed to mercury during, many, many years, and I'm assuming you hadn't done all these precautions, how did you actually clean it out, not knowing that, not being able to do so ahead of time?
Yeah, so I had to do a very slow chelation. So chelation is grabbing, basically. Or chelation is pulling. I had to pull it out from all of those different places. And so there's chelators that you can use. And a lot of these systems, there's some different chelators. You can use zeolite. You can use even chlorella is a real low dose kind of thing. Chlorella or even cilantro are some low dose things that you can use. EDTA is another that you can use. So there's different versions of things you can use to pull the mercury first and then to dump. So you need to have also some antioxidants, glutathione, things that can help you really counteract the effect of that mercury in the system also. It's interesting because when I first started to go through getting rid of the mercury, basically doctor said, this is going to take a long time. And it did. It was years before I really went, okay, my brain's back. I can tell it's back. So this is something that you really need to have someone helping you through, to making sure that you're getting it all pulled out and getting rid of it all. But here's another piece actually along with the mercury that I think is important. You can't just do a blood test to assess this, because the mercury hides. It hides in the tissues. You have to do what's called a provocation test, meaning you're going to take something that's going to pull the mercury out of those organs first, and then you do a urine test, because it's going to pull it out and then you're going to eliminate it. And the mercury that actually is in mercury fillings is going to eliminate through the kidneys. So the urine test is going to be the most accurate. There are multiple tests you can do that you can test hair, you can test blood, you can test urine, but the most accurate is going to be a provocation test. You pull it out, then you urinate it out, and you test what comes in that urine. And you can get these mercury provocation tests. It's going to be much more accurate.
Great, thank you so much. You also made a comment on vegan and vitamin uptake. So Dr. Michael Greger, I don't know if you're familiar with his work.
Mm-hmm. Yep.
Dr. Michael Greger has a video and where he talks about a dietary intake study that showed that vegans were deficient in calcium, iodine, and B12, whereas omnivores were deficient in calcium, fiber, folate, iodine, magnesium, C, and E. So I'm just wondering where you're basing that vegans have a problem with uptaking vitamins. Is there research on that supports that?
There is research, and it starts with Dr. Weston Price. So it's the fat soluble vitamins that are the concern. And the problem with our food supply is that most of our food is deficient in everything that we need. So it's often not how you're eating anymore as much as what you're eating, the sourcing for your food. And most of the food, like you said, fiber deficient in omnivores. Well, meat doesn't have fiber. So that's a big piece where they're missing out on that as well. So it's a combination of all of those things put together that are necessary to be able to get these nutrients. I have a lot of health practitioners that I see as patients. So, I see the doctors, I see the health coaches, I see the chiropractors. They come to me as patients. And those that have a vegan diet have some of the worst teeth that I've seen. And they're frustrated with this. They're saying, why? Why do I keep getting cavities? And so we very closely look at what could you be missing? And it's usually the fat soluble vitamins. So those are the pieces that they supplement. Once they supplement, things are okay. Things are okay. But It's just hard to get them if you're not eating any sort of animal product whatsoever.
All right. Our next question is Leah. Leah, where are you from? And please ask your question.
Hi, my name is Leah. I'm from Davie, Florida, and I have a 5-year-old daughter, and I was curious, what's your take on fluoride for children and the toothpaste?
They don't need it. So it's the same talk that I talk about with adults and fluoride. Teeth don't need fluoride. Teeth are not deficient in fluoride. So the best way to care for a child's teeth is to use a hydroxyapatite containing toothpaste or tooth powder. The one concern with the paste is to make it a paste, you need to add a binder. And the binder that's often used is glycerin. It just holds things together to make it a paste. Well, glycerin, when used on a tooth, actually plugs up the tubes that we want the minerals to get into. So what I find is that there are more minerals that are being uptaken by the tooth through a powder than a paste because of that glycerin or binder component. So I recommend a tooth powder. I've got a kid's tooth powder that's citrus flavored, hydroxyapatite containing, and it helps a ton with keeping kids cavity free. So no, fluoride is dangerous in anybody, especially a child. There are options that are just as good, if not better, than fluoride now with hydroxyapatite.
Thank you. Our next question is coming from Bonnie. Bonnie, please state where you're from and ask your question.
Hi, my name's Bonnie, and I'm from Bowie, Maryland. I had a couple questions. The first one is I just had some deep cleaning done for some pocketing, and they recommended a full mouth series, not the typical panorama one that you get, but the full mouth series so they can see everything in there. Would that be similar to the CT scan you recommended? And my second question is, I also have sleep apnea. I've been through the CPAP, the mandibular device, the laser. They talked about my jaw maybe being a few millimeters short and surgery. I'm going to have a sleep endoscopy, but you mentioned a growth plate. What would you recommend that over surgery, or when would you do one over the other? Because I'd rather that less invasive if possible. Thanks.
For sure. For sure. Oh, remind me of your first question. I just forgot it now.
The full mouth
Bonnie, please restate your first question.
Yes, the full mouth series.
Yes.
Is that the same as the CT? Okay.
Yep. Okay. The answer is no. And the difference is a full mouth series means they're going to be taking x-rays, individual inside the mouth x-rays of every single tooth. They're using that for gum disease because it does show the bone level next to the root. So it is a good thing to look at if you're assessing gum disease. However, it is not the same. The cone beam CT scan is a 3-dimensional image. I can literally take your whole head and do this to it. I can do nothing like that with a 2-dimensional full mouth series. So full mouth series is just a traditional dental x-ray. They're just taking a whole bunch of them. So it is not the same thing, unfortunately. Second question about sleep apnea. Well, good question. I see a lot of patients post-jaw surgery. What you need to understand about jaw surgery is that they are going to section the bone, either upper or lower, either way. They're going to reposition it, and then that's going to be screwed in place and fixed in place with plates and screws. That's all metallic. I have so many people coming and saying, can you please get these plates and screws out? And I have to tell them I can't. It's too invasive and it's too dangerous. We cannot remove those. So 100,000%. It is so much better to do an expansion appliance. It's a removable appliance. You just wear it when you sleep. It takes about 18 to 24 months, but it's only nighttime wear. It's going to grow the jaw rather than cutting and screwing the jaw in a new position. So a bazillion times over, do the appliance over surgery.
And are there, now you mentioned, so I have a question for you. So you mentioned, a whole slew of different kinds of symptoms that could be indicative of an oral infection. Is there anything that we'd be able to tell, that would be more, like if you have a tooth pain, obviously that's easy to say, okay, that's could be an oral infection or some other problem. Is there anything other than just, you're tired and that, where you'd go, okay, that definitely sounds like an oral infection?
That's one of the tricky parts, is because there's not a lot of local symptoms. There's not a lot of local pain or things that we can identify. That test where you open your mouth and you say, ah, and can you see the back of your throat? That's a good one. Because if things are swollen back there, it's an indication that there's probably something going on infection-wise. If you have had a root canal, 90% chance that there's probably infection underneath the end of it. So these are just all things to go, do I have it? Yes. All right. Probable. Look in the mouth. Are things swollen? Yes. Probable. As far as wisdom teeth goes, the big one for that is going to be endocrine problems. So if you have thyroid problems, Hashimoto's, you can't keep adrenal strength, you're just always wiped out. Wisdom teeth areas, almost every single time.
Okay, so if you had an implant or root canal or wisdom teeth taken out, you should prophylactically, or just go and get one of these cone beam.
Go have it checked out.
Perfect. Thank you so much. Our next question is coming from Diane. Diane, please state where you're from and ask your question.
Hi, I'm from Boynton Beach, Florida, and my question is about the implants. I'm supposed to get an implant, and I keep putting it off because I am afraid of, it affecting organs. I do have periodontal disease for many years now, but this one tooth is like shifting down and twisting, and it's affecting the tooth next to it. But I just keep putting it off. One, for financial reasons, but also because I know it's going to probably affect other organs. And I have a lot of stuff going on: ulcerative colitis, neuropathy, diabetes, and probably others. I'm just nervous talking to you. So I have a lot of stuff going on. So I didn't know what else you could add regarding implants.
The first thing that I can say is that tooth being infected like it is affecting you as well. So the things that you listed could 100% be related to just that infected tooth that you have that's shifting and moving. Teeth don't do that unless there's infection. And you said you have periodontal disease. That's gum disease. That's gum infection. So you have disease already in your mouth. The first step is get that tooth out. There are other ways to replace it. I don't know where the tooth is, if it's in the front or the back, but there's other ways to replace it other than a dental implant. But get it out, because that's the first starting point. Take care of the gum disease. That's the starting point. Don't even worry about the dental implant for the moment. Honestly, you probably shouldn't get a dental implant right now. If you have active gum disease, the dental implant has a higher chance of failure. Don't get it yet. Get the infection out first. Use removable appliances, retainers with teeth, those kinds of things temporarily for now until you can get infection controlled. Once it's controlled, then start looking at dental implants, those kinds of things. But now is not the time to do that. Now is the time to get the infection out. That's step one.
Great. Thank you. Our next question is coming from David. David, please state where you're from and ask your question.
Hi, this is David again from Framingham. So a follow-up question on the extraction, doctor. You state the risk that can be done from a not good extraction. How can I make sure that it's made right with my dentist if I need to make an extraction? And my next question is, what are your thoughts about electric toothbrush or ionic toothbrush?
So with the extraction, we do the same procedure that we do when we clean out the bone and cavitation areas. We make sure that the ligament is gone. So these are things to ask your dentist. Make sure the ligament is gone. We disinfect that area very well with ozone, and then we fill it up with those stem cells that I talked about. It's called PRF. So if you do those three things, then you're not going to have the problem of the area not healing after the tooth is removed. So you specifically need to ask for those. As far as a toothbrush goes, honestly, it's more important to me that you're brushing and using the brush correctly rather than the type of brush. So I'm not very specific on the type of brush. I don't care if it's electric or ionic or just your own hand, as long as you're just getting the things off of the teeth, using it properly, and not putting a whole bunch of toxins into your system with the toothpaste you're using.
Great. Thank you. Our next question is coming from Amy. Amy, please state where you're from and ask your question.
Hi, this is Amy. Thank you very much for the presentation. I'm from New York City. I have varicose veins along the side of my tongue, and the past month or so, they've become painful when they rub against my molars. Is there any way of removing varicose veins from the side of the tongue?
No, there is not, but it always is a sign. This is a sign or a symptom that we need to pay attention to. So if you have varicosities, it means that things are backing up and the blood flow is changing in the side of the tongue. So we have to say, well, why? Why is that changing in the tongue? Most infection, in your case, it's probably an airway issue. I suspect you're not breathing very well at night. You're squeezing your teeth, which sucks the tongue into the sides of the teeth and causes soreness on the side. I suspect this is actually an underlying sleep apnea issue. So my first step for you would be to actually do a sleep test.
Okay, thank you.
All right. Our next question is coming from Paul, and we just have like 1 minute to answer the question. So Paul, please state your question.
Hi, thank you. My question is about dental infections and cavities. I'm getting cavities even though I brush my teeth and floss. Does help? I know you spoke about tooth powder. I will try that. Does it help to swish your mouth with hydrogen peroxide or ozone? Or what else can I do to help prevent cavities besides brushing and going to dentist and get my cavities filled?
You need to look at gut function. Most likely you're not absorbing nutrients. So I have a remineralization kit that I would recommend you check out that has vitamins and minerals for the inside, tooth powder for the outside. Usually if you keep getting cavities and you're doing everything right, it means that you're not getting the nutrients you need and your body's stealing them from your teeth. So I would look at your gut first. Hydrogen peroxide and ozone are just going to kill bacteria. They're not going to add minerals back. So if this is a bacterial issue, you have too many bacteria, that's going to help. But I suspect it's actually a nutrient issue and you need more nutrients into the system and into your teeth than killing bacteria.
Great. Thank you so much for that really very impressive presentation. It was very educational. So the audience, I'm sure, would like to show their appreciation as well. So we're going to open up the mics and you'll hear a whole cacophony of thanks.
Thank you so much.
Thank you very much. Thank you.
Amazing information.
Thank you.
Lots of
Bless.
very, very nice. Thank you.